Miss Smith.
Hi.
Hi, I'm Allison.
Nice to meet you.
I'm a nurse practitioner student working with Miss Jones, your primary care provider today. Is it okay if I conduct an interview that discusses your health history?
Sure, of course.
Okay. First, let me just start out and confirm your full name.
It is Amanda Smith.
Okay. And how old are you?
I'm 25.
Okay. And now tell me, what brings you in to see us today?
Sure. So I've been experiencing some left shoulder pain at the front of my shoulder for the past 2 to 3 months. I initially felt it when I was at the gym. I was doing a bicep curl and I was doing a little bit of a heavier weight than what I usually do, and I felt kind of like a pull. And ever since then, it's kind of just been a dull ache at rest, but it will usually increase in severity if I'm doing a similar motion to what I did before when I originally heard it, or if I'm like reaching up or anything like that. But I've been taking ibuprofen up until this point. But since it's been going on for so long, I thought I would come in.
Okay. Now tell me, when the pain is most severe, how bad is it on a 0 to 10 scale, with 0 being no pain and 10 being the worst pain you've ever had? How would you rate your pain?
Sure, I'd say it was a 7 or is a 7.
Okay. And does the pain come and go, or is it always there?
It's always there. It's not always a 7.
Okay.
Usually it'll be kind of mild, but if I'm doing something similar to the motion when I heard it, it will get to a 7.
Okay. And other than the ibuprofen, have you tried anything else to relieve the pain?
No, I'll ice it sometimes, but it's mainly with the ibuprofen.
And that does offer you relief?
Yes.
How much ibuprofen are you taking?
I'll take 200 milligrams, so
Okay.
400 milligrams at a time.
And just as needed?
Yes.
Okay. Alrighty. Have you noticed any clicking or popping when you move the joint?
No, I haven't.
Do you have full range of motion when you do try to extend your arm? Any limitation?
Yeah, I have full range of motion, not really any limitation. I feel the pain a little bit more as I go through the range of motion, but I still have full range of motion.
Any other symptoms with the pain?
Not that I can think of at this moment.
Any numbness or tingling above or below?
No.
No? Any deformity that you've noticed in the joint? Any swelling?
No.
No? Okay. Alrighty. And when you have the pain, about how long does it last when you have the severe 7 out of 10 pain?
Sure, it'll last a few hours, but it starts to get better over time.
Okay. I'm just jotting some notes here so I can remember all these details you've shared with me. Okay. Next, I just want to move on and get a better understanding of you and your overall health. So how about you just tell me a little bit about yourself? You know,
Sure.
just tell me what you do with your time, work, school, hobbies, family members, just that sort of thing, so
Yeah.
I can get to know you a little better.
Sure, so I graduated with my bachelor's a few years ago, and the year after I got a paralegal certification. So I do work at a law firm in the area as a paralegal. I currently have a boyfriend that we've been together about 2.5 years, and I also have a cat, and his name is Farrell.
Okay.
I enjoy being outside, going to the gym, going to theme parks, you know, stuff like that.
Okay, very good. And with your exercise, obviously you've referenced going to the gym. How frequently do you partake in any exercise?
Sure, I go about 4 or 5 days out of the week. Usually when I'm there, I'll do some weight training mainly, and I try to mix in some cardio 1 or 2 out of those days.
Okay, all right. And how would you describe your diet?
Generally healthy. I try to get enough fruits and vegetables, grains, lean protein, enough fiber. I don't really eat out too much, probably once or twice a month. Yeah.
Okay, very good. Any food intolerances or any food allergies that you're aware of?
Yeah, I do have some food intolerance with certain vegetables, but nothing that has been diagnosed from it.
Okay, alrighty. Do you use any tobacco products?
No.
Have you ever in the past?
No.
How about alcohol? Do you ever drink any alcoholic beverages?
Sure. I do socially, so if I'm out to dinner, I'll have 2 or 3 drinks, and That's probably 1 or 2 times a month that will happen.
Okay. Alrighty. And you referenced your relationship with your boyfriend for a little over 2 years, is that
Mhm.
correct? And is this a monogamous relationship?
Yes, it is.
Are you all sexually intimate?
Yes.
Is there any concerns for sexually transmitted infections or HIV, either from this current relationship or any
No.
past? No? Okay. Are you currently taking any contraception?
Yeah, I'm on norethindrone, and I take that, obviously pills.
Okay, okay, got it. Alrighty. Good, thank you for that. Now I just want to move on and discuss a little bit more of your overall health history. Are you allergic to anything, any medications that you know of?
Yeah, I'm allergic to penicillins, and I have seasonal allergies.
Any medical problems, which would be illnesses or injuries as a child for you?
No, I did have a concussion when I was 16, so that was probably the only injury that I could.
Okay, and how did you sustain that injury?
It was sport related.
And did you have any residual effects from that?
No.
Anything impacted at all from that now?
Mhm.
No? Okay. How about as an adult, any illness or injuries?
No.
Ever had any hospitalizations?
No.
Okay. How about surgeries? Any surgeries as a child?
Yes, I had my tonsils out when I was 8.
Okay. How about surgeries as an adult?
I had my wisdom teeth out a few years ago.
Do you know about how old you were when you had your wisdom teeth out?
20.
Okay. Alrighty. Any problems or complications with those surgeries? Any problems with anesthesia during those surgeries?
No.
Okay. Alright. Do you take any medications other than the birth control and the ibuprofen?
No, I do take a multivitamin in the morning, but nothing over the counter, nothing else prescription.
Okay. No other supplements, maybe like pre-workout or anything like that that you
No.
take? No? Okay. Alright. Immunizations. Did you have all of your childhood immunizations?
I did, yes.
Okay. What about your annual flu vaccine? Did you
Mhm.
receive that?
Yeah.
Any vaccinations that may be required for out-of-country travel?
No.
No? Okay. So to your knowledge, are you up to date on everything? I know it's a lot to keep track of all the date for your immunizations. So if you could provide us with your immunization record, so we could input that information into your medical record, that would be
Sure.
helpful. It would allow us to review it and see if there's immunizations that you're due for now.
Of course,
Okay.
yeah.
All right. All right. How about screening tests? Have you recently had a hearing or a vision exam?
No, the last time I had those were probably 2 years ago, and both were fine. There was nothing abnormal with either of those.
Okay, very good. Next, I want to discuss some family history.
Sure.
Again, to get a better idea of anything that may impact you at some point. Tell me if you have any siblings and describe their general health.
Sure, I have 2 brothers and 1 sister. All are still living, and they all have a clean bill of health. Nothing abnormal, no chronic disease has come up.
Okay, nothing like diabetes, cancer, high blood pressure, anything to do with their heart, any cancers, anything like that? No? Okay, so let's talk about your parents. Describe your parents' health to me.
Sure, my father has a general clean bill of health. My mom has hypothyroid, and that's the only thing that that's of importance.
Okay, let's talk about grandparents. How would you describe your grandparents' health?
Sure, so all of my grandparents are deceased. My maternal grandparents, my grandfather passed away just of natural causes. My grandmother passed away of liver cancer, and then my paternal grandparents both passed away of just natural causes as well.
Okay. Okay. That's helpful to know. All right, next I want to just go over all of the body systems and just make sure that there's nothing else that, we've missed or that's a concern.
Sure.
So I'm just gonna kind of ask about a bunch of common symptoms here, and just let me know yes or no. And if there's something that you answer yes to, I just want to talk about that a little bit more.
Sounds good.
Okay. So just in general about your overall feeling of health lately, have you had any fevers, chills, night sweats,
No.
anything like that? No? Okay. How's your appetite been?
Appetite has been the same,
Okay.
nothing abnormal.
Any unintentional fluctuations in your weight, up or down?
No.
No? Okay. Any concerns about your weight? Okay. How about your skin? Have you noticed any changes, any rashes,
No, I have not.
any concerns with any changes in moles or anything like that? Okay. How about your hair? Any been losing abnormal amounts of hair
No.
or a change in the texture that's concerning?
No.
Okay. How about your nails? Any pitting in your nails? Are they increasingly brittle? Any change in color or thickness?
No, not that I've noticed.
Okay. To include not only fingernails but toenails as well.
Yeah.
Okay, just making sure. And with your skin, no dryness, itching, anything like that?
No.
Okay. All right. Moving on to just your head and neck. Any headaches, lightheadedness, dizziness, anything like that that you've experienced?
No.
How about any lumps or bumps in your neck?
No.
Anything like that?
No.
Any enlargement or swelling that you may see in here that
No.
would be concerning for your thyroid? No? Okay. Any difficulty swallowing or anything?
No.
Okay. I know you told me about the concussion when you were 16. Did you lose consciousness with that?
No, I did not.
Okay. Have you ever just passed out?
Mm-hmm.
Okay. Moving on to your eyes, I know you told me you had a vision exam a couple years ago that did not demonstrate any concerns. Have you ever experienced any vision changes like double vision or blurred vision?
No.
No? Okay. Any dry eyes or excessive tearing of your eyes?
No.
Okay. Have you ever worn glasses or contacts? Okay. Moving on to your ears, any ringing in your ears?
No, not that I've experienced. No.
Okay. How about any drainage from either ear? No. Okay. And again, I know you said you had a hearing exam with no concerns, and I'm assuming that you don't wear any hearing devices.
No.
Okay. All right. How about your nose? Any change in smell?
Mm-mm.
Okay. Any nasal drainage? I know you said you had seasonal allergies. Do you have any?
Yeah, I mean, when it's allergy season, I will be a little bit more, have a little bit more of a runny nose. It's usually just clear, and it's not excessive, it's pretty mild.
Okay. How about sinus pain or pressure with that?
No.
No. Okay. Any history of nosebleeds?
Mm-mm.
Just double checking, make sure I don't miss anything. Let's move on down to your mouth. Have you recently had a dental exam?
Last time I had one was about 6 months ago, and nothing abnormal with that.
Okay. Any painful lesions or sores, anything in your mouth that's
No.
causing you trouble, to include on your tongue?
No.
No problems with that. Any sore throat?
Mm-mm.
Okay, I know you already told me no difficulty swallowing or anything. Okay. Moving on down to your chest and lungs. Have you recently had any cough, congestion, anything like that?
Mm-mm.
Any shortness of breath?
No.
I know a lot of these that I'm asking about kind of correlate with
Yeah.
the current coronavirus symptoms that they're screening for, so we have to ask those things. To your knowledge, have you ever been exposed to anyone with tuberculosis?
No, not to my knowledge.
Okay. Have you ever had a chest x-ray?
No.
Have you ever had a little PPD on your arm to screen for that? Has that ever been positive? Okay. Moving on down to your breasts here. Have you noticed any changes in your breast at all?
No, I do a self-exam a few times a year, and usually I haven't found anything to date.
Okay, that's good. So no pain or tenderness that you've noticed?
No.
Any changes in the skin of the breast?
Mm-mm.
Okay, and no lumps or bumps or nodules?
No.
Okay, to include up in the armpit area,
Correct, yeah.
up in the axilla. Okay. Any mammogram for you?
Mm-mm.
I assume not, you don't meet the age criteria, but I always just double check, make sure we haven't missed anything. While we're at the chest, I just wanna talk a little bit about your cardiovascular system. Have you ever experienced any chest pain, chest tightness,
No.
any discomfort? No? Ever had palpitations or felt like your heart was racing and it was gonna jump out of your chest?
No.
Okay. Ever had any difficulty breathing when you're laying down or anything?
No.
Okay. How about any activity intolerance when you're working out at the gym? Just ever?
No, I've never experienced it.
Okay. How about any swelling anywhere in your body?
Mm-mm.
Ever been told you have high blood pressure?
No.
Okay. Any unusual bruising?
No.
Ever had any concerns with clotting disorders or blood cell disorders?
Mm-mm.
Okay. How about anemia? No concerns with anemia? Okay. Moving on down to your tummy. Any concerns about your tummy?
No, just the food intolerance like we spoke about before, but it's not really a huge concern. I just stay away from those foods.
Okay. No nausea, vomiting, diarrhea, anything like that? Any irregularities with your bowel movements?
No.
Okay. You've not noticed any change in your stool color, any blood, or if it's dark, tarry,
No.
stools like that? Ever any concerns for any severe abdominal pain or ulcers?
No.
Nothing like that? Okay. I assume you probably have your gallbladder and your appendix, because
Yes,
you didn't.
they're still intact.
Just making sure you didn't share that with me when we talked about surgery, so I want to double check. Okay. Just moving on to kind of your reproductive health here. When was your last menstrual period?
It was 2.5 weeks ago.
Okay. Any concerns with that?
They're pretty normal, 5 to 7 days, and the flow is usually medium. It's not too heavy or too light. There's not really any clotting that I would be concerned about.
Okay. Alrighty. And when was your last well woman or pap exam?
Sure, it was in November.
Okay. Have you ever had an abnormal pap? Okay. Have you ever had any pregnancies?
No.
Okay. And you already told me that you're using contraception.
Yes.
Any urinary symptoms, any changes in your voiding pattern or anything?
No, I haven't experienced anything.
No pain when you're trying to void, odor with the urine, cloudiness or anything with the
No,
urine?
not that I've noticed.
Okay. Have you ever had a urinary tract infection?
No.
How about any concerns with your kidneys or lower back pain? Okay. Okay. Other than the left shoulder pain that brought you in today, do you have any other concerns with any joints in your body?
No.
Any achiness, stiffness, swelling, anything else?
No.
How about any muscle pain or soreness?
No, not outside of, just being sore after a workout.
Okay, to be expected. Alrighty. Have you ever had any weakness to any extremity, to your arms or your legs, anything like that?
No.
Any concern with balance or coordination? Okay. Have you ever had any seizures?
No.
How about decreased sensation anywhere in your body? Have you ever had a tremor or a shakiness? Okay. Any concerns about your behavioral health or mental health? Any concerns for depression, anxiety, anything like that?
No.
Have you ever had any thoughts of wanting to harm yourself? How would you describe your coping with stress? Do you feel like that's well, or do you have any concerns with that?
Yeah, I think that, when I'm stressed, I have coping mechanisms that I put into place in order to decrease the stress and anxiety.
Okay. How about your sleep? Describe your sleep to me.
Sleep is pretty normal. I sleep at night, and typically I try to get 7 to 8 hours of sleep. Once I fall asleep, I'm asleep. It's not really restless or anything like that.
Okay, so it's uninterrupted sleep. Okay. Do you have any questions or anything you want to add?
No, not at this time.
sometimes when I'm going through that, it triggers, other thoughts, so
Yeah, sure.
I like to kind of take a moment and pause and reflect that. Before I go out and discuss this with your primary care provider, I just want to review what brought you in, make sure that I have all the accurate details. So you came in for left shoulder pain to the front of your shoulder here that you said started about 2 to 3 months ago. And you rated at its most severe 7 out of 10 pain. That is relieved with taking ibuprofen as needed.
Yeah.
The initial onset of the pain you said felt like a pull when you were doing a bicep curl or extension motion. And you don't have any other symptoms, no numbness, no tingling, no weakness. You haven't noticed any swelling or anything else associated with that pain. Is that correct? Okay. Any questions?
No.
All right. Well, I'm going to go step out and, like I said, review this and make sure there's nothing that I neglected to address, and we're going to come back in and do your physical exam then.
Sounds good.
Okay. All right. Well, thank you for allowing me to participate in your care
Sure,
today.
thank you.